Whilst no system can ever be totally secure from a manipulative and deceitful predator like Savile, we learned last year that there were clear failings in the security, culture and processes of many NHS organisations, allowing terrible abuse to continue unchecked over many years. Some victims are sadly no longer with us, and others continue to suffer greatly as a result of what happened. On behalf of the government, I apologised to them last June, and today I repeat that apology. What happened was horrific, caused immeasurable and often permanent damage, and betrayed vulnerable people who trusted us to keep them safe. We let them down. As one of the Stoke Mandeville victims said, "There are so many messed up lives. Although people have built up lives, you have children, you make a life, it ruins everything. Your relationships with another human being, the things you're supposed to have." Today we must show by our deeds, as well as our words, that we've learned the necessary lessons. The new reports, like those released last year, make extremely distressing reading. In total, 177 men and women have now come forward with allegations of abuse by Jimmy Savile, covering a period beginning in 1954 to just before his death in 2011. At least 72 people who gave evidence were children at the time of the abuse, the youngest only 5 years old. The allegations included rape, assault, indecent assault, and inappropriate comments or advances. Allegations were made not in one or two places, but in over 41 acute hospitals. That's almost a quarter of all NHS acute hospitals, as well as 5 mental health trusts and 2 children's hospitals. Further investigations have happened at a children's convalescent home, an ambulance service and a hospice. There are 3 new investigations underway at Humber NHS Foundation Trust, Mersey Care NHS Trust and Guy's and St Thomas's NHS Foundation Trust. There is no suggestion that ministers or officials knew about these activities, but accepted governance processes were not followed in the decision to allow Savile to inquire and maintain a position of authority at the hospital. In particular, ministers made the expedient decision to use Savile not just to raise funds to redevelop Stoke Mandeville's National Spinal Injuries Centre, but to oversee the building and running of the centre, even though he had no relevant experience. Because of his celebrity and useful fundraising skills, the right questions, the hard questions, simply were not asked. Suspicions were not acted on, and patients and staff were ignored. People were either too dazzled or too intimidated by the nation's favourite celebrity to confront the evil predator we now know he was. Never again must the power of money or celebrity blind us to repeated clear signals that some extremely vulnerable people were being abused.